The topic for tonight is Wi-Fi in schools. And when we read what's recently come out in the international media, April 23rd, for example, out of the UK, danger on the airwaves, is the Wi-Fi revolution, a health time bomb. It talks about, in every coffee shop and every school being Wi-Fi access and what this is doing to our health. Scientists demanding inquiry over Wi-Fi. The research hasn't been done. We cannot assume that wireless networks have no effects. Another headline from The Independent on Sunday. So there's a dramatic public uproar right now occurring about this concept of Wi-Fi in schools. The first question I would like to start with is, what is your take on the usage of Wi-Fi in schools, and what do you see, before we jump into major details, what do you see kind of on a 30,000-foot bird's eye view level being the key issues as it relates to Wi-Fi usage in schools?
Well, Alfred, the first thing is that, we understand now so well what the mechanism of harm is from the information-carrying radio waves, and Wi-Fi, of course, emits information-carrying radio waves, so that we have the same broad range of health concerns with Wi-Fi that we do with cell phones and other types of wireless technology. The most interesting opportunity with the Wi-Fi problem is this, is that with cell phones and cell phone base stations, those are two areas that the FCC in the United States has jurisdiction over, and two areas where the Food and Drug Administration gave the cell phone industry a variance or a pass in terms of requiring pre-market testing. So cell phones were not pre-market tested prior to going into commerce, and neither were wireless base stations. However, Wi-Fi is a different type of issue, because neither the FCC nor the FDA have taken jurisdiction over Wi-Fi, so that we really are in a situation where if parents in schools and if other concerned parties make a stand, there is no regulatory authority that will keep Wi-Fi from being tested. We made a huge mistake with cell phones by not testing them prior to market. We don't have to make the same mistake with Wi-Fi, although right now it seems as though around the world most schools are going in that direction.
Well, let's talk a little bit about some of the conditions that we are suspecting or that we're seeing as a result of this wireless blanketing of many high school, university, and junior high school campuses across North America and the world. When we first talked about this topic a few weeks ago, you mentioned disruption of brainwave profiles. I remember a study coming out of Europe not too long ago that showed that cell phone usage, for example, has a residual effect on the brainwave profile of children in particular. But can you comment a little bit on some of the learning ability issues and cognitive deficits that we may be seeing due to wireless exposure 24 hours a day?
Yes, Alfred. The fundamental mechanism here is the disruption of intercellular communication. The information-carrying radio waves cause the cell membrane to close down so that active transport channels are not permeable, and you have the cell becoming nutrient deficient, energy deficient, and the cells are not able to talk to surrounding cells. Now, if you take a closer look at that mechanism, that means that nerve cells, for example, are not able to talk to each other the way that they're supposed to be, and that has a direct impact on cognition, our ability to learn, young people's ability to learn, young people's ability to focus. And indeed, there are now a number of studies that have been done in laboratory animals that show that these information-carrying radio waves indeed impact the ability to learn, the ability to retain information. And interestingly, there are now studies that show that behavioral problems in children in schools are related to Wi-Fi. meaning that you have not only cognition problems but also disciplinary problems and other issues that are a direct result of the synapses not working the way they should in these young people. And that is where we are so concerned, because we're looking at a fundamental disruption of physiologic process. But when it comes to young people in school, we are talking about the future of our society. And we already know that with young people, they are more susceptible to the types of damage that we know come from the information-carrying radio waves. And the reason for that is simple, that up until about the age of 18 to 20, biological tissues, cells, are differentiating more than they are proliferating. In other words, they are changing, exposing a lot of DNA more than they are growing. That's why if you look at a picture of yourself, for example, when you were 12 years old and compare it to a picture when you were 14 years old, you'll see a difference in the profile, a difference in the way the person looks. And that is because the cells are differentiating. They're changing as the child goes through his or her maturation process. And when you have cells that are differentiating more than they're proliferating, that means there's more exposed DNA. That means there's more opportunity for interference with DNA repair, and that is what actually puts these young people at far greater risk of health effects, learning problems, sleep disorders, behavioral disorders, all the way to autism, higher risk across the board. And that is why it is a tragedy in the making, with schools all around the world bringing in Wi-Fi and actually convincing the parents that this is an advance, that this is something that is good. A school with Wi-Fi is better than a school without Wi-Fi, and it is absolutely a tragedy.
Well, you know, it's very interesting, Dr. Carlo, that when listening to these different conditions that you're pointing out and the different kind of domino effects that we're seeing, that internationally this has really received a lot of exposure already and a lot of discussion. You know, for example, in Great Britain, Professor Laurie Chalice says that the whole mobile phone and wireless industry could turn out to be the cigarette of the 21st century. I mean, how poignant is that? Professor Lee Salford of London University is deeply worried about Wi-Fi's additional electrosmog. And in Austria, my home country, the Medical Association is lobbying against the deployment of Wi-Fi in schools because the authorities of the province of Salzburg, for example, have already advised schools not to install it, and they're now considering an entire ban. Dr. Gerd Oberfeld, Salzburg's head of environmental health and medicine, says that the Wi-Fi is dangerous to sensitive people, and the number of people in the danger are both growing. So it's very interesting to see that countries, especially in Central Europe, have really picked up on this topic already. And I remember reading recently that a Canadian university has taken a stance against this already, and they've basically banned Wi-Fi access from the university campus. Now, the question that I had for you was, you know, knowing that we're exposed to so many stressors already. I mean, there is air pollution, there is water pollution, there is toxicity in food. There's a tremendous amount of stress already on us. Would you say that electropollution, being one of those spokes on the wheel, or the Wi-Fi access that we all on one hand enjoy, but on the other hand is that additional stressor that kind of may tip the scales for us from a stress perspective and from a human toxicity perspective, that, you know, that is what puts us over the edge? Is that possible?
Well, Alfred, I think it's worse than that. Because, you see, all of those other stressors, all of those environmental exposures, we're able to develop compensations for those. Our immune system is able to respond to them, and our nervous system is able to respond to them. But what we have here with the Wi-Fi and the damage from the information-carrying radio waves is that our immune system becomes compromised. So the information carrying radio waves, the Wi-Fi type of exposure, is more serious than one of the spokes in the wheel, because it makes these young children more susceptible to all of those other stressors, all of those other exposures. And to make matters worse, Alfred, is that we have now, in the Safe Wireless Initiative, been doing testing in schools around the world. We have Safe Wireless Initiative branches now in the United Kingdom, in Ireland, in Canada, also in Channel Island of Jersey, and when we look at the amounts of information carrying radio waves in those schools, it is interesting that because of the construction of most of these schools, schools have an interesting construction because it's public construction usually. It's less expensive construction. There's a lot of metal. There are a lot of metal walls. And what happens is that the information carrying radio waves, the dangerous waves, become trapped in the schools. The schools actually become resonant cavities. So the exposures in the schools from Wi-Fi are greater because those information carrying radio waves cannot get out. So not only are we talking about a fundamental disruption of the immune system that makes these young people more susceptible, we are also talking about an environment that concentrates the dangerous radio waves, and it underscores once again how tragic a mistake this is for us to be putting Wi-Fi in schools across the world.
Well, what I find very interesting about this discussion, Dr. Carlo, is not only when looking at the angle of the students, but also looking at the angle from the teachers and the professors. Because, these are individuals that are highly regarded, many of them, that are very educated, and that have a huge responsibility on grooming our kids and our teenagers. They spend oftentimes more time with our kids and teenagers than the parents do. So let's talk a little bit about, I know we talked about kids and teenagers, but also from the aspect of a teacher, meaning an adult being exposed for an extended period of time to this information carrying radio waves and to that type of stressor. What do you think from a behavioral pattern perspective, from a focus pattern perspective, what can we expect there? What do you anticipate happening to these individuals that have such a large responsibility to educate our youth?
Well, a couple of things come to mind, Alfred. The first is that most of these teachers are in these schools for many, many, many years. So that while the children will move through a middle school, for example, in 3 years, or through a high school in 4 years, and certainly be exposed during that time, the teachers sometimes are there for 25, 30, 40 years. So that you're talking about now looking at a chronic exposure to something that is very, very dangerous. And we actually have been talking to many representatives of teachers' unions, because this is the kind of thing that moves into the workers' compensation area. When you have chronic exposure to these information-carrying radio waves, we're not only talking about an inability to focus, and tempers may be becoming a lot more prevalent. Teachers losing patience. All of those are things that we would expect based on the exposure, but more seriously, we would expect things like brain tumors and leukemia, lymphoma, those types of chronic conditions. So the first thing is you really are talking about an occupational hazard that up until this point has not even been recognized. And then the other thing is that you are talking about a profession that requires the ability to learn, the ability for high levels of cognition, and the ability for very, very good communication skills. And what we would expect to be seeing here are are teachers losing their ability to have patience, to have that cognition because of the disruption of intercellular communication. So all of these items are very, very important from not only the student's perspective but also from the teacher's perspective. And I will say that on May 21st, in the United Kingdom, Panorama, which is the United Kingdom's version of 60 Minutes or 2020, is going to have a very, very provocative 1-hour documentary special on Wi-Fi in schools. And that will be May 21st, and the listeners should be able to pick that up on the Internet. And what's important is that I know I have participated in this documentary, and they will be covering all of these angles: the teacher angle, the student angle, the fact that many of the conditions that we would expect from the information-carrying radio waves, difficulty sleeping, unexplained anxiety, difficulties in focus, those are symptoms that most people would not even recognize as symptoms. So that what they're going to be focusing on in this documentary is the need to shock people into paying attention. So I would encourage people to mark their calendars. This is going to be a very, very important, very important program. And Alfred, back to your earlier point, it's interesting that something like this comes out of Europe. It doesn't come out of the United States. We have had, for example, many opportunities in the Safe Wireless Initiative to work with schools, and invariably, every time there is somebody on the school board who is tied to one of the cell phone companies on the board of trustees of private schools, and the next thing you know, the whole effort is shut down. So this is one of the problems in the United States that they don't have in Europe, is that the power of the industry to effect their will on the system is much greater here. We seem to be much more responsive here to monetary pressures, and that is why something like this very important program on Wi-Fi will come out of Europe first before the United States.
Dr. Carlo, I wanted to ask you another question, and that's the tie-in of some of these conditions you mentioned, ADD, ADHD, some of the issues that we feel are correlated to or contributed to by electropollution, and to some extent at least, and pharmaceutical drugs and what's being prescribed, especially to kids and teenagers in schools today. Can you shed a little bit of light as what your theory is of the correlation between the two, and how electropollution really plays a major role, or may play a major role in how these conditions are treated and how people go about it?
Sure, Alfred, and you again, hit the nail on the head. One of the difficulties is that, for the past 5 to 7 years, and of course that is the time frame when we have the most dramatic increase in wireless technology use and background exposure to information-carrying radio waves, and I've mentioned this to folks before, that it took 20 years for the first billion cell phone users. So by the end of 2004, we had our first billion. 18 months later, we had the second billion, and 12 months later, we had the third billion. So, we are looking at an exponential curve in terms of the increase of exposure to these information-carrying radio waves, most of this in the last 4 or 5 years. When you read the educational literature, the pediatric literature, the medical studies that are published in those journals, folks are talking about an increase in conditions like ADHD, hyperactive disorders, learning problems. And what's happening is that the conventional medical community, they treat these kids with antidepressants and Ritalin and those types of pharmaceutical interventions. And most of the time they tag these kids as having some type of inherited behavioral disorder. And they put the blame on the parents, and they put the blame on the kids. And we look at this much differently, because we know that when intercellular communication is disrupted, the pathology that ensues is the baseline or the basic pathology for attention deficit hyperactive disorder, for learning problems, difficulty focusing, and that these conditions should not be treated with pharmaceuticals. These kids should not be on drugs. The parents should not be blamed for the circumstance. And we find that this is one of those areas where when we are able to talk about the cause, the information-carrying radio waves being the cause, parents, first they breathe a sigh of relief and say, my God, I'm glad it's not me. I'm glad it wasn't me. And I'm also glad it's not my son or it's not my daughter. So as folks are out there talking to people in schools and talking to parent-teacher groups and to other school society groups, teachers groups, don't be afraid at all to point out that we are over-medicating our children and that the information-carrying radio waves are indeed related to these types of conditions, and that we can prevent them. These conditions are preventable. It means they're unnecessary. We don't need to have our children suffer. We don't need to have our teachers suffer. There is a way to fix this without medication, and as I say, without blaming the parents and without blaming the children.
Dr. Carlo, looking into the future, what do you see as it relates to electrosensitivity? If the current tendency of entire cities, entire counties, entire regions, even entire countries going wireless, so in other words, even individuals that choose not to use, let's say, a cell phone or cordless phone, or choose not to have a wireless router in the home, inadvertently we are exposed, whether we like it or not. What do you see happening with electric hypersensitivity levels? Right now the World Health Organization estimates that only 3 or 4% of the world's population has a condition called electrohypersensitivity, but the reason that makes me question that statistic, and I think it's way underestimated, is the fact that many people don't even realize what they are feeling is related to electropollution to a great extent. So what does the future hold from an epidemiology perspective for EHS or electrohypersensitivity when the tendency is to blanket the globe with wireless access?
Well, the term electrohypersensitivity in and of itself underestimates the condition. The condition that you're speaking of probably occurs 3 to 4 times a higher incidence than 2 to 3%. It's probably more like 10 to 12%. That condition, the electrohypersensitivity, is one of a number of conditions that are under a syndrome that we call membrane sensitivity syndrome. And membrane sensitivity syndrome is the cell membrane pathology that occurs after someone has chronic exposure to these information-carrying radio waves. And it is a very debilitating condition. This is not something that is trivial. People who have membrane sensitivity syndrome, the electrohypersensitivity variety of membrane sensitivity syndrome, they are debilitated. If they're in a room where there's Wi-Fi, or if they're in a room where somebody turns on a cell phone, they have to leave. They have an autoimmune response. They become nauseous. Some of them pass out. When they go home, they have very, very severe stomach problems. Many of them bleed. They end up having blood in their stool. They're not able to work. Their spouses wear out. Many of them, their marriages break up. They have difficulty with their relationships with their children. It is an extremely debilitating condition that is afflicting, we believe, almost in the double-digit % of the population. The other thing that happens here is that in the 1980s and 90s, there was a new condition called multiple chemical sensitivities. And multiple chemical sensitivities is membrane sensitivity syndrome that is induced by chemicals. So you have a whole group of people out there who suffer from multiple chemical sensitivities, and what we are finding is that everyone who has multiple chemical sensitivities also has electrohypersensitivity. So that what's happened here is that the information-carrying radio waves trigger the adverse immune responses in these people who are already afflicted with the exposure from the chemicals. So we are very, very concerned. You know, as you may remember, we run a registry in the Safe Wireless Initiative where we gather data with people who have these types of symptoms, and we study that. We are opening up registries now in Canada and England and Ireland and other places around the world because no one else is counting. That is the tragedy here. We in the Safe Wireless Initiative have the only registry in the world that is tracking what happens to people who are exposed to these information-carrying radio waves, and our assessment, our fear here is that this has moved from a health risk issue to a medical problem for so many people. And that is another reason why we think it's so important that we are able to intervene with these young children in schools, with the school boards and the parents in these schools, because that is going to be the best place to make progress, because there is no regulatory authority who will interfere. When we look at cell phones, the FDA and the FCC, they interfere with our ability to protect people. And when we look at base stations and towers, the FCC and the other regulatory authorities interfere because they're being pressured by the industry. With Wi-Fi in schools, there is no opportunity for interference because there is no regulatory authority who has taken jurisdictions.